Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Sharlee Dixon, and today I'm joined by Sheetal Shah. Sheetal is the founder and CEO of MettaHealth Partners, a consulting firm dedicated to helping public health and social service organizations navigate digital transformation with compassion and efficiency. Sheetal's career has taken her from the front lines of a dengue epidemic in Brazil to leading digital health initiatives in Ethiopia, all the way to shaping national policy under the Obama administration. With over 2 decades of experience supporting value-based care, Medicaid transformation, and health equity initiatives, she brings both global perspective and grounded expertise to the work. Sheetal holds a master's in public health from George Washington University, is currently pursuing an Executive MBA at the University of Chicago Booth School of Business, and continues to center loving kindness, metta, in every aspect of her mission. We're thrilled to welcome Sheetal to the show today to discuss how MettaHealth Partners is harnessing AI and digital innovation to lead value-driven, equitable transformation in public health, blending global insight, ethical technology, and compassionate strategy to help mission-driven organizations create meaningful, lasting impact. Sheetal, thank you so much for coming on the show today. Welcome.
Hi, Sharlee. Thank you so much for having me. I really appreciate it.
Absolutely, absolutely. I want to get started by talking about your path to founding MettaHealth Partners. I do understand that it is a global organization and it's very deeply personal for you. Can you share what inspired you to start your company and what the word metta represents in context to your mission and your work?
Yeah, absolutely. And Sharlee, thank you again so much to the Triad team for inviting me to be here. And I'm so excited to chat with you all today and tell you all a little bit more about MettaHealth Partners. So the term metta is a term from Buddhist philosophy, which means loving kindness. And it represents a deep, active interest in the well-being of others. And so that intention, really guides everything we do at our company. And, my own journey through the healthcare system, I was diagnosed with epilepsy as a teenager, and I was really lucky. I had access to health insurance through my parents. But, that awareness that not everybody, had that really kind of became more into my awareness after college. And it kind of really opened my eyes to the disparities that people face. And, I've kind of carried along those feelings, all throughout my career. But when I started MettaHealth, it was really important for me to really be intentional and focus on helping bridge those gaps. And I have a background in product development and technology, and I'm an optimist when it comes to technology. I think there's a lot that it can offer. But, at the center, it's really important, that we keep our humanity in everything that we're doing as we're trying to advance digital transformation.
Absolutely, absolutely. And speaking of humanity, the work that you have done has really taken you from country to country, working on various causes, from things like HIV/AIDS education in Argentina to tech-enable health policy right here in the United States. How have these global experiences shaped your approach to equitable healthcare transformation today?
Yeah, thanks so much, Charlie. So I learned so much working abroad. And I say if I've given a fraction of what I've gained from this work, I would be grateful. So I think overall, when I reflect on my journey working abroad, as well as, under some massive pieces of healthcare legislation here in the US, I think it taught me that while systems differ, the root of care is always grounded in connection. So whether it was sitting, in a rural area in Ethiopia or advising state Medicaid agencies here in the US, it really became clear to me that you can't just, and I'm using air quotes, tech our way out of structural inequality. But, we can use technology to thoughtfully expand access, improve care, improve quality, to help reduce provider burnout, and honor the lived experiences of the individuals and communities we're serving.
Absolutely. And you mentioned kind of bridging that gap between technology, public health, connection with people. Can you give us an example of how AI or even machine learning has helped improve specific outcomes for a client or a community as large?
Yeah, for sure. So recently, MettaHealth Partners, we had the privilege of supporting a federal agency on one of its first AI initiatives. And so I say, our work focused less on what is like that flashy tech and
Mhm.
more on the thoughtful design. So we started with ideation workshops that gave those frontline teams just the space to name what their real pain points were. And that was across multiple work streams and programs. So from policy to communications to contracting and procurement to general operations. So, instead of kind of rushing into solutions, we tried to help leaders like identify what are those high value, realistic use cases that are grounded in the staff's daily work. And sometimes the answer was automation, but other times it was also just like better processes. So along the way, I think what, we learned was that most teams aren't really asking for these like really complex algorithms. They're asking for clarity, they're asking for support, and just even understanding what's possible. And I would say, like, as a team, as we reflected on that engagement, one of our biggest takeaways was that to implement AI, and I think any technology well, you need a strategy. And strategy is a team sport. So real transformation happens when we can combine the technical know-how with what I think of as deep empathy for the mission of what your organization is trying to do. And that's where I think my team thrives, is like being at that intersection of innovation and humanity.
Nice, very nice. I took a look at your website. It's beautiful, by the way.
Oh,
And
thank
one of
you.
the absolutely one of your main philosophies. It really does. You continue to talk about connection, and one of
Yeah.
the main philosophies that I noticed throughout the site was that change happens at the speed of trust. Can you discuss that belief with us and how it has guided
Yeah.
your work with public health ecosystems and digital transformation?
Yeah, thank you, Charlie. Thank you so much for asking this. This is, one of our core values, and again, it's like really embedded into
Yeah.
everything that we do, and guides our approach as consultants. And I'll say sometimes I've had in the past a bias against consultants, but as organizations adopt artificial intelligence, whether it's to improve decision making, automate processes, or personalized services, I know everyone's in a different place on their AI implementation journey. I think that pace and success of the transformation are not really determined solely by the technology alone. Instead, it really hinges on human trust. And it's trust in the tools, it's trust in the data, it's trust in the leadership, it's trust in each other. And so AI transformation is not just a technology journey, it's a human one. And so, and I think trust is the engine that drives it. So when we say like change happens at the speed of trust, tactically for us, that means leading by listening, co-creating and co-designing solutions with our partners, and building and working with technology partners, that reflects the values of the organizations and the communities we serve.
Very nice, very nice. So I do understand that some of the AI tools that you have built kind of streamline data extraction and prediction. So really identifying maybe some readmission risks for
Yeah.
health agencies and things like that. How do you tailor those tools for public and even nonprofit organizations that may not be as familiar with emerging technologies? I mean, I think people are still kind of afraid of some of the
Yeah.
technology and AI and that kind of thing. So how do you tailor those tools for each agency?
Yeah, yeah. So I think where we kind of start with our approach is we say we start small, and that's what we kind of tell folks. Otherwise, it almost feels overwhelming. It can feel too
Yeah.
big, and so to kind of just you can start somewhere, right? Is just starting somewhere is really important, and then we do our best to use plain language, visual guides, examples that we hope that resonate for staff with their everyday workflows. So, like, for example, you might hear people say RPA or robotics process automation, which sounds super technical,
Mhm,
but
it does.
a simple way to think about it would be like, imagine you have a stack of paper forms that need to be typed into a computer system, one by one. And normally, like, a person would have to sit there and do that manually, line after line. And on the other hand, now imagine you have what is like a digital assistant, and that could read those forms and enter information in automatically. And that's basically what RPA does. It takes those like repetitive, time-consuming tasks and does them quickly and accurately without burnout. And I think what's really, nice about like RPA, for example, is that it's really great for organizations that operate a lot in paper, like, a lot of nonprofits that, we work with do. And so to know that these tools exist is one step. And I think, what we say to folks is what could take a team a week might now just take a few hours. And that's not just time saved, but it's time that your staff and, folks on your team can now spend helping people, solving problems, and improving services. So when we look at those emerging technologies, we do want to start with the problem and the pain points that staff have, but we want to co-design with the staff, not just, hey, here's some technology for you. And so the goal is ultimately to make AI feel like it's a helpful teammate and not a tech burden, if that makes sense.
It makes complete sense because I know a lot of people are just, like I said, they're just really kind of scared about what AI is going to do and it's coming in to take our jobs, that kind of thing.
Yeah.
And so I really appreciate that you want to integrate it into just having another teammate here to help solve the problem instead of it just kind of taking over and no longer needing that human connection, period.
Yeah. And I think the fear and the concern, like I think with technology, there's always gifts and there are dangers. And I do feel like there's with this, I think the fear and the uncertainty is incredibly, valid. So I will say that's part of the reasons why we created the AI learning series was we wanted to start to demystify these topics in a way that's kind, it's inclusive, and it's down to earth. And so our goal with this too is that, people can walk away feeling a little bit more confident, more empowered to use these tools in service to their clients and kind of become more involved in the co-creation of the solutions. And the other thing is that in the learning series, we also have, we point to, there's a lot of resources and a lot of guides out there. And I'll send you guys the link to this to include in the notes. But basically the one of the frameworks in terms of risk management and security that the ecosystem points to is this NIST framework. And what they say is, what I really love about it is that they really have a call to action for people of all diverse backgrounds and teams coming to the table to discuss how AI gets implemented. So I feel like for folks that are listening, hopefully that's, a call to action that even if you're not a technical person, we still need your voice at the table to make sure that we, responsibly and safely and ethically implement AI.
We'll be right back after a word from our sponsor.
Whether you're a longtime or first-time listener to Behavioral Health Today, you're probably familiar with Triad, the company that brings you this podcast. But you may not know that Triad also hosts a community for current and aspiring behavioral and mental health professionals, featuring trending content and education and career resources, all for free. If you are a behavioral or mental health professional, or you're studying to become one, join more than 80,000 people on Triad by claiming your free professional account today. Visit us at hellotriad.com/BHT. That's hellotriad.com/BHT and join the Triad community today.
Absolutely. And speaking of the AI digital learning series, can you talk a bit more about what that is, what it entails, who is the program for, and what should learners take away from it, or what do you hope they take away from it?
Yeah, for sure. Thank you for asking. Yeah, so we have a self-paced AI learning series. There's about 6 one-hour sessions. And so we just go through the basic fundamentals of AI. So we scratch the surface about machine learning, natural language processing, robotics and robotics process automation. We touch a little bit on generative AI. And then what we also try to do in the series is give folks tools and resources that look at governance, safety, and ethics. And I know that's a really broad category, but there's some really good resources and tools out there. So, we try to give folks what we see are really valuable tools out there. And then we end with a session on strategic planning and implementation considerations. So the hope is that if you're someone, that's a little bit new to AI, maybe you played around with like ChatGPT or Gemini, or or if you go on Netflix and you like the recommendations, you're using AI. So if you're someone that's like, kind of keen to learn a little bit more, this will give you the basic fundamentals. And then The idea is that if you are eager or interested in like thinking about how you can apply some of those tools in the context of your organization, it starts to scratch the surface of, hey, here's where you can start when you're starting to plan and implement. But ultimately, yeah, we hope people walk away just feeling a little bit more confident about, the basics and fundamentals of AI.
Nice. So just going a little bit deeper with that, would you then suggest that organizations that are looking to add more AI-based strategies, would you suggest then that they look into the digital learning series? Or who is it
Yeah.
for? Yeah.
Yeah. Oh, sorry. Yeah. So for who is it for? So when I was building the company, I really loved the idea, and I will give a shout out to my wonderful advisor, Maura Harris. She is the director of strategic initiatives at the Services for Underserved, one of the largest social service agencies in New York City. And I was like, Maura, I want to start this company. You're kind of my persona of who I would love to, help learn about AI, because kind of at that time, I think a lot of, nonprofit leadership, they see this wave of AI coming, but they might not be sure where to start. And, Maura is kind of the person that, she does all sorts of different projects, and she's always wearing the strategy hat of like, okay, there are these new things happening, but they might be new initiatives, right? They might be new Medicaid initiatives. They might be technology initiatives, but how do we think about it strategically aligned to our missions, vision and goals? And so I kind of see, folks and it's really open to anyone that they could be in operations, they could be in strategy, they could be in executive leadership. We have folks who are in data analytics. So the people that have come to the learning series span really a variety of roles. But I would say it's for the folks that are thinking about the strategy and the kind of the 2-3 year plan for the organization. I think it's a great place to start. And then to kind of just get your bearings if you don't have a technical background or you haven't worked with, AI before, or you're maybe familiar with generative AI, but there's a lot of other fields of AI that I think could be really valuable for organizations. So it's to kind of serve people who wear those types of hats than for anybody who's interested.
Very nice. Okay. It's funny. A lot of people think that AI is this, mystical thing, and not saying that, portions of it are not. But I really appreciate that you mentioned using Netflix and the recommendations.
Yeah.
And I love ChatGPT. I use it for all kinds of things,
Great.
including my son's math homework. So I think the digital learning series is something that I actually might look into as well. Not that I'm, a strategical person in my current field of work, but I do find it to be interesting. So it's cool that this isn't necessarily just set for one group or one professional out there.
Yeah, exactly. And thanks, Sharlee. And we'd love to have you come to listen to it. But it's also, because we also wanted to have really tactical applications. So the way the series is structured is we give kind of what we think are the basic terms and concepts that folks with non-technical backgrounds should have as they're engaging in conversations with AI, especially if you want to work with different vendors that offer AI-related products and services. But then at the end of kind of each series, we offer like what are examples of tactical applications. And I really like that, because then it gets people's brain juices starting to flow of like, oh, I could use it this way on this thing, on this project I have, where it just helps like kind of bring out the creativity in people in terms of how they could apply it in their day-to-day work.
That's really cool. That's really cool. And speaking of kind of giving people the opportunities or the options that are out there, when you're working with clients that come through MettaHealth Partners, how do you determine which tools, whether it's like I mentioned, like a ChatGPT or the robotics programming or other platforms, how do you determine what is best suited for their unique challenges and goals?
Yeah, so I love this. Thank you for asking. And I will say, as a consultant in this space, the tools are constantly evolving. It's a lot to keep up with. So, it's so interesting. Like a few months ago, even, we would hear like, this tool is really great for this type of use case. And this tool is really good. This other tool is good for that type of use case. But honestly, to take a step back, I think it's better to start with like, what is the problem first that we're trying to solve? And not like kind of just the tool. And so once we dig into like, what's the pain point, dig into the workflow, understand the challenge or the staff pain point, I say, and then we test a few options side by side, we'll have a better sense of what tool may be best longer term, but we're also really cognizant that we don't want our partners and the organizations we work with to feel locked into any specific solution right now, because the tools and technology is evolving at such a fast pace. So we also then want to pay close attention to things like privacy, security, accessibility, the ease of use, especially because we know folks are stretched so thin at kind of in the behavioral and mental health space. So there's definitely a variety of factors, I would say, that go into the decision-making process. And yeah, so I'll pause there and hopefully that helps.
It does. It definitely does. Because like you mentioned, there are so many different options. And again, my knowledge of AI is very small, but even I know that there are so many different options and different applications and different ways to bring in processes to help programs function. And it really is interesting. You specifically work with nonprofits because, determining that return on investment for an organization that already does not have money, and helping them to save time, like you mentioned, on manual processes has got to be important. So how do you help people determine when and how to use the AI? And is it something like, okay, this program works for now, but maybe later we can adjust it and change it as new programs are coming out?
Yeah, that's a great question. So I would say the strategic side of this is to, again, like think about like the cost, which right now is these tools can be very costly, is what we're hearing from the field. But then try to look at what are the parameters that are also really important to the organization. So for example, like we know in New York State right now, there's, from the health and human services aspect, there's a big Medicaid delivery system reform initiative. So I think these kind of bigger transformation initiatives also give folks an opportunity to think more strategically over the next 2 to 3 years. Like, what are the different initiatives, the programs that they want to implement? And then I see technology as more of like one of the tools to help advance the mission and vision of the organization. But we are like living in a time right now where a lot of folks are concerned, and rightfully so, like where's the funding going to come from? And so part of the work too as well is like, for any of this stuff, we need an investment strategy. So MettaHealth Partners will also help with that, kind of thinking about, yes, you might have some public sector money, cross fingers, hopefully. But if not, we've got to start thinking about what are those different reimbursement models? Where is their philanthropy money and other kind of pots that can support the organization? So, I think it's a really interesting and challenging time, but, the folks that will lean into AI to see where it can help them, even with the grant and the funding, I think is really important.
Absolutely. Absolutely. So it really sounds like a lot of people's fear around AI has a lot to do with ethical use of this technology, right? Because you can use it to do some things that are not necessarily positive or they hurt the human connection. How does MettaHealth Partners ensure that these AI solutions remain human-centered and then align with values like equity, inclusion, compassion, that type of thing?
Yeah, thanks, Sharlee. So I would just, for the folks that are listening, I think this is such a great question. And again, a place where I hope folks feel called to participate in those conversations around the ethical application of technology. And just as, there's a case that I've been following with Character AI. It's a Google-backed company. It's a chatbot, and it's, teens and young adults have been using this and developing those connections. So it's going to be one of my understanding. I'm not the legal expert, but my understanding, this is going to be one of the first AI companies to kind of go through our legal process. So I think it'll start to set some legal precedent on how companies that provide these products and services, get looked at from a legal perspective. But at a high level, I think from, our perspective of, helping organizations ethically adopt and implement technology, we kind of look at it at every part of the project lifecycle. So we want to always be asking ourselves and our partners, like just some basic questions, like, is this fair? Is this transparent? Are there any consequences that we haven't been thinking of? And in order to do that really well, you really need a diverse set of voices at the tables. So we want to make sure that we're, supporting how to invite all members of the organizations, not just the executives, but staff at all levels to help understand the answers to those types of questions. And then again, there are some great, like I think risk management frameworks like the NIST tool that I mentioned. And there are checklists, right, that help us ensure that we're going through the process and baking into the process opportunities to ask those questions and collaboratively come up with, what we think are the answers to those questions. But again, I think any ethicist would tell you ethics is not just a checklist, it's an ongoing practice.
Yeah.
And so, and one speaker I have to say that I heard last summer that I just really resonated with what she said and loved. It's like, she said, just because you can do it doesn't mean we should.
Mm-hmm.
And I love that because I just think it's like something we always have to be asking ourselves, just because we can do it, like, should we?
Should we? Mm-hmm. Absolutely.
Yeah.
I've heard that quote as well. And it does resonate with me and probably lots of others, because we can do all kinds of things, but are they really things that we should be doing?
Right? Yeah. So I really loved it too.
Absolutely. And speaking of guiding principles, again, taking another look at your website, one of the things that I was curious about, what is the double bottom line? And can you talk to us a bit more about that and how it plays into your work?
Yeah. So thank you so much for asking that. So the double bottom line is this idea that you can have profit and have positive social impact, and the two are not in tension with each other. And I often think we are, as a society, maybe we often think that there is, and I do think there is, right, this tension of profit versus purpose. But, in our work, we believe that we can achieve both. We can have a profitable business and we can achieve positive social impact. And so everything we try to do also wants to make sure that, again, like I said, I think technology is in service to humanity, and we want to help folks adopt tools and technology safely and responsibly and ethically. But we don't want to do it to the point where we're chasing after profits and not thinking about the holistic, broader, all living beings essentially in our planet.
Absolutely. Thank you for that. Actually, this next question kind of goes along with that. And then something we mentioned earlier, I alluded to that you have worked in so many varying countries, discussing varying cases of different things, whether it is, startup agencies, large nonprofits in major cities, large scale government initiatives like Obama era, the American Recovery and Reinvestment Act. What lessons have you carried forward in the consulting work that you do today? Just because your experience is so varied, I'm just really curious on the things that you've brought forward from case to case or program to program.
Well, I would say, first, the older I get, the more I realize I don't know.
Yeah.
But I would say, there's this African proverb that I love, which is like, if you want to go fast, go alone. If you want to go far, go together. And I think, especially in my time under the Obama administration, but then also when I worked, in New York City at some of these healthcare startups, I was lucky to see some of the most amazing private-public collaboration. And I really felt like that left an imprint on me, whether it was advancing health IT adoption or implementing value-based care models. You really saw folks from across the ecosystem come together and really try to figure out solving these complex problems. But I think, the real, when we talk about real change, it's that combination of it takes urgency as well as patience.
Absolutely.
And then the second thing I think about that, even when you have the best policy or the best tech, it won't work without relationships. So whether you're scaling nationally or just doing a pilot locally, I think people and the ability to build those genuine connections and trust is everything. And, I think ultimately it's just really, those are, I think, the key ingredients, as well as just always showing up authentically.
Absolutely. Absolutely. So continuing with your discussion about your broad experience from predictive analytics to rural education programs, what trends are you most excited about in the future of health tech and public health innovation?
Yeah, well, so I'm an optimist, and I just love the creativity of the human spirit. So, I think when I was just reflecting, I was I'm excited about what hasn't even been discovered yet. So in Buddhist philosophy, there's this idea that humans don't actually invent things. We simply become aware of what already exists.
Mhm.
And, that really resonates with me. And so, I'm inspired by the ingenuity, the creativity, the collective intelligence, we bring when we're truly present with a problem. And I think the most powerful solutions will come not just from the new technology, but from new ways of seeing. And that really gives me so much hope.
Very nice. Very nice. And so then as we begin to wrap up just a bit, for organizations or leaders who want to leverage technology to reduce disparities and drive impact, where do you recommend they start? Is it with the digital learning series? And how can MettaHealth Partners support them?
Yeah. So thanks so much for asking. So I would say my first recommendation is to start by just naming the problem that drains your team's energy or limits your reach as an organization. And that then provides maybe some of the ideas to start to plant the seed of where then we can identify where technology could help. And whether you work with MettaHealth Partners or any consulting firm, you want to make sure that you bring people that are going to help you brainstorm, ideate, and not feel like, I don't think people should feel a pressure to be like tech savvy, just a shared commitment to make systems more human, more efficient, and more equitable.
Very nice, very nice. And again, I'm really enthralled with your experience. So I'm curious. Tell me about your most invigorating, most fulfilling experience that you've participated in, and it can be again something from a small startup in New York to something you've done in another country to things that you've done for the government. I'm just really curious about that type of work you do.
Yeah. Oh, well, thanks for asking. I mean, I've been, I think, really fortunate. I've worked abroad. I've worked on domestic policy. And I think the thing I'll just say that immediately comes to mind, though, is so when I was in grad school, I spent a summer working in Brazil, in the south of Brazil. And it was really fascinating because I was in the city called Moringa, where I would spend the mornings at the state public health department. And then I would spend the afternoons at the city public health department because Moringa was the state capital. So they had both the state and local public health departments. And it was so interesting when I was working on, as an intern, I was working at like the state department. So I would be like reading things about policy, like trying to research and like analyze and like provide it to different teams. And then when I would go to the local public health department, they were actually at that time facing a dengue epidemic. And, my role was I was doing data entry for them. They would give me a stack of papers. This is where, they had patients that had dengue. And my job was to put it in a spreadsheet with the address and, name and different PHI. And then the staff members would take those papers and then they would mark it on a map. And then they would deploy staff to those areas where they thought, they had pools of water. So, dengue just as background, it's a mosquito-borne illness. And it's usually where like mosquitoes, there's stagnant water. And that's where like the larvae like forms. And that kind of just like seared in my mind because I was like, I'm happy to do this because I'm a student. I will do data entry. But I think, I was like, what a burden for staff to have to sit there and take these things, in paper forms. And then, that kind of experience was really formative. And then, a couple of years later, when I went to Ethiopia, I think a lot of it is just like really luck and good timing. But, we were going through a business process reengineering effort with the university. And they were like, Sheetal, do you want to, work on helping the university health clinic implement technology? And I was like, sure, I would love to. And, at that time, I didn't realize, but what I was being asked to do was product management and basically getting like a really light database to kind of enter clinical information. But, long story short, fast forward, 2 decades later, I'm doing this AI learning series. And one of the use cases that we talk about is, there's now these AI powered sensor drones that will go around and basically they can help look for those stagnant pools of water. And basically with up to, I think it's like 90% accuracy, see where those pools of, where there might be the dengue epidemic happening they can target that and then basically like also use the drones to disperse pesticide and stuff because,
Wow.
otherwise there's no cure, there's medication, but that's like
Mhm.
one of the prevention tactics. So I just think it's so interesting when you kind of look at like the span of 2 decades, how technology can like really support public health interventions and improving care and improving quality. So, I think that was for me one of, it was a burdensome, thing to do, but like
Right.
as I like reflect on it, I'm like, wow, we've come so far that people
Absolutely.
don't have to do that anymore if they don't want to.
Right. That is really awesome. Thank you for sharing that. Thank you.
Yeah, of course.
Yeah. So for those listeners who want to learn more about MettaHealth Partners or get involved, where is the best place to start and where can they find more
Yeah.
information about your work?
Yeah, thank you. Well, you can visit us at MettaHealth Partners, and that's Metta with 2 T's, METTA, healthpartners.com. Or if you want to reach out to us directly, that's just the info at metahealthpartners.com. And we're always happy to brainstorm, collaborate, or simply listen. And if you're curious about AI and not sure where to begin, you can check out our digital learning series. There's a tab on our website that says AI training, so you can just click through that. And you'll see that there's a self-paced, plain language intro to AI designed specifically for health and human services and public health professionals, and just tools to help you learn how to do your work better, faster, and hopefully with more joy.
Awesome. Awesome. Sheetal, I have really appreciated speaking with you today. I really enjoyed this. Thank you.
Likewise. Thanks, Sharlee. Thanks for having me.
Absolutely. And thank you to our listeners for taking the time to join us. You can follow us on all of our social media at Instagram, TikTok, LinkedIn, and more. We're even on YouTube at Behavioral Health Today. And if you like our show, make sure to give us 5 stars and leave us a review. That helps our show get discovered and share the valuable insights in each episode. As always, the resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.